Hello out there. We're on the air. Time for another podcast from 7 Jars of Hot Pickled Peppers. All about providing information to find your way through the roller coaster ride called life. I'm Christine, one of your hosts and a stroke survivor. My own roller coaster ride has had a few loop-de-loops, but I'm so lucky to be able to share with you some of the things I've learned. Me and the whole 7 Jars team wants to help you on your own ride and let you know you're not alone. Join the conversation.
Welcome to 7 Jars of Hot Pickled Peppers, Season 3, Episode 2. Yawn. Holy, you're making me yawn. Hello, this is Ken. The information, conversations, and advice provided by Christine and Ken, the hosts of the podcast 7 Jars of Hot Pickled Peppers, are not a substitute for the advice and treatment plan provided by your own healthcare professional. Further, it's not intended to be an adjunct to any existing or proposed advice or treatment plan you may currently be receiving from your healthcare professional. Each individual, their family, and their own journey is truly unique. The information provided through the podcast and from guests is general in nature and solely intended to let listeners know that they are not alone, that there are resources available to them, and to provide information for rehabilitation and treatment. Please discuss your own personal needs and circumstances with your healthcare provider. You can join the conversation on YouTube and Facebook at 7 Jars of Hot Pickled Peppers for our video version of the podcast. You can check out our website at 7jarsofhotpickledpeppers.com. Or you can download our podcasts on iTunes or Podbean. And of course, you can follow us on Twitter at 7 Jars. Now it's time for Quote of the Cast. Treat energy the same way you treat money. It's a finite resource that needs to be wisely managed and invested. Dan DePenny.
My days were brimming with activities, things to do, lists to accomplish. I regularly got up at 5:15 and didn't stop until after 9 p.m. And I liked it that way. Although I dreamed of holidays, when we did take one, I jammed it full of touristy activities. We never missed a thing. Even my fast walking pace reflected my desire to do as much as possible in the time I had. Fast forward to the present post-stroke me. Ken has to watch his pace, so he doesn't get too far ahead of me. I have to take breaks and watch repeated TV shows. I've never watched so much TV as I have since my stroke. When I get tired, it's a full-body physical and mental takeover that incapacitates me. And I know what tired looks like, feels like. Well, at least I thought I did. I used to work 12-hour shift work, switching from days to nights. I sometimes played gigs until 1 a.m. and then went to work the next day. I knew how to manage tiredness, get through it successfully. Post-stroke fatigue is an entirely different animal, one I'm still learning how to cope with.
Introducing today's guest. Dr. Saddiqui completed his research and clinical fellowships in stroke at the University of Alberta and is a stroke neurologist at the Grey Nuns Community Hospital. He also travels to Camrose, Alberta, lending his expertise at their stroke clinic. He is sensitive to the fact that having a stroke redefines a patient's sense of self and well-being, and believes that a collaborative approach is essential to successful treatment and rehabilitation.
Hello, Dr. Saddiqui. Thank you so much for joining us today and sharing your knowledge on post-stroke fatigue. But first, can you tell us a little bit about yourself?
Well, Christine, thank you so much for allowing me the privilege to join your greater family of stroke advocates and educators. It's really a pleasure to speak with you today. I am a neurologist, and my special area of interest is stroke.
Right.
And I am always inspired to be here in Camrose at our heart function and stroke prevention clinic that has been such an oasis of advocacy with a community that, like yourself, is really invested in the vascular health of the patients here in rural Alberta. When I'm not enjoying the special ambiance here in Camrose, I'm in the Greater Edmonton area at the Grey Nuns and the University Hospitals.
Okay. So some traveling for you.
Barefoot neurologist, have brain, will travel.
Oh, that's fantastic. That's fantastic. So I wonder if you could just, what is post-stroke fatigue?
Yeah. Well, I think before even defining it, I did want to say that it is an underappreciated symptom of stroke. It refers to the generalized sense of lassitude and, as the name would suggest, fatigue.
Right.
That isn't necessarily related to the challenges precipitated by the specific functional deficits that a stroke patient may have in the early phases of the rehabilitative journey.
Okay.
And so it is often counterintuitive that it should be such a pervasive symptom of stroke, and is often under the radar for a lot of our patients who aren't really prepared for just how their sense of, well, putting it colloquially, their sense of pep has been so eroded, and how the stroke has really disproportionately knocked the wind out of their sails is something
Right.
I've been told quite often. But similarly, it's often underappreciated amongst caregivers, family members who are as much a part of the rehabilitative journey, and even practitioners alike. So it refers to that symptom of fatigue that occurs after a stroke, and is truly an underappreciated hurdle that many of our stroke patients struggle with.
Absolutely. And it seems to be one of the many invisible kind of ailments that people undergo. Mental health or all these types of things are invisible.
Yes.
So is stroke similar to being tired, or is it a completely different animal?
Well, that's really also a good question. I think, and even the fact that you're asking it alludes to perhaps some of the reflex perceptions we have about stroke. We tend to perceive stroke in its most dramatic presentations. And indeed, of course, those are challenging and precipitate and impose on patients many challenges of that protracted period of rehabilitation. But the whole spectrum of deficits varies so widely.
Yeah.
Because, as you know, a stroke is simply a vascular event affecting an area of the brain. And that can vary in its extent and in its distribution, with its symptoms varying accordingly. They can be as subtle as feeling tongue-tied, to being as dramatic as being unable to move or communicate verbally. There can be just the most subtle degree of clumsiness, for example, as you're manipulating your keyboard that you've noticed, etc. So we tend to first and foremostly think of stroke as being the dramatic loss of function, which of course it is. Right. And I'm actually very grateful that over the past decade or so, given the degree of increasing public awareness and education, that it has grown increasingly less common for us as frontline physicians who look after stroke patients to contend with the tragic circumstance where a patient wakes up in the middle of the night unable to move half of their body and then nonetheless still casually decides to sleep it off. Reassuringly, we don't see as much of that anymore. But nonetheless, a lot of that awareness revolves around that focal deficit. Just think of our acronym as well that we've popularized, right?
Yes.
Face, arms, speech, time.
Right.
So what may be contributing to that conceptual bias is that we perceive the deficits and challenges of stroke as being due to what one might have previously referred to as handicap fatigue. What I prefer to use the term exertional fatigue, where the fatigue is perceived as being related to surmounting the deficits that an individual has.
Okay.
And once those deficits are gone, well, let's celebrate those milestones and move on.
Sure.
Okay? In much the same way that certain cognitive aspects of stroke and mood-related and mental health-related aspects of stroke are part and parcel of that underappreciated, or the word you used was the invisible, long-standing challenges associated with stroke. Post-stroke fatigue, similarly, is often underappreciated. And it's worthwhile suggesting then, perhaps, when we're speaking to the medical aspects of the syndrome, that conceptually we like to think of it in terms of being of two phases or two types.
Oh, interesting.
There's early post-stroke fatigue, which is felt to be related to a lot of the biological factors associated with the whole process of neurologic injury, early neurologic injury associated with stroke. Okay? Think about how miserable you feel when you have the flu.
Yes.
Okay?
Especially as a man.
Oh, yes, that's right. So even if it's a flu with a lowercase rather than a capital F, right? And why is that we feel so miserable with illness in general? It's due to the demands, the energetic demands on our body as we are struggling to fight disease. It's due to the elaboration of inflammatory mediators in our body that are part and parcel of that period of recovery, but that contribute to all those symptoms that make us feel not just stuffy, but tired.
Right.
As well, and groggy and such. So when the earliest phases of a stroke occurs, there is a cascade of reactions that occur biochemically and physiologically, in which a lot of these factors are released throughout your body. And certainly within the local environment or microenvironment of the brain itself. Okay?
Sure.
And so there is a sense of fatigue due to this neurologic impairment, not just from the specific area that's affected in the stroke, but that more broadly affects the brain's function in the immediate wake of a stroke due to these cascade-like processes. So that's the first component of post-stroke fatigue. Okay? This early post-stroke fatigue. And this will be within the first 6 to 8 weeks, first couple of weeks primarily. And then late post-stroke fatigue. That's a different kind of fatigue.
Interesting.
And that is often seen after people have endured their robust period of rehabilitation.
Right.
After they've already gone through boot camp.
Yes.
Okay? And after we've done all that we can in the early phases to try to encourage as robust a recovery as possible. Okay? And again, this seems counterintuitive because now the clumsiness may have resolved, the gait may have improved.
Sure.
Okay? The dexterity and strength, overt strength, may have improved. And we celebrate those milestones. And what is seen then is when patients then return home or return to work, that it's like the last 4 kilometers of that marathon.
Yeah.
All of a sudden you've hit a wall again, and people are unprepared for it. So this late post-stroke fatigue is seen in that 2 to 3 month period after a stroke, when people are transitioning back into the community, back into their leisurely activities, their personal and basic activities, and certainly their professional activities.
Right.
And so it's very important for patients and employers and caregivers to appreciate this.
Right. Absolutely. In your experience, it's an unfair question because every person is an individual, and every stroke, I suspect, is very individualistic.
Absolutely.
So to ask, is post stroke fatigue common? Can that even be answered? Is that pretty regular that somebody is going to encounter? Say, well, everybody should technically go through phase 1, and then that phase 2. Does most everyone experience that as well?
It's very common amongst our stroke patients.
Wow.
Do you see patients without the post-stroke fatigue?
Yes, we will see some patients where that process, shall we say, is that trajectory of recovery is very robust and accelerated. So these will be our patients who have a robust pre-stroke state of health, our younger patients, and also have more minor deficits.
Right.
But not invariably so. Right? Even patients, as I said, where a lot of the more dramatic deficits may have resolved, will still experience just that sense of generalized lassitude and fatigue, certainly in those first 6 to 8 weeks, and then often even when they're returning to work.
Right. So, in your experience, is there any set or expected timeline for how long this fatigue can last?
Yeah, I think that if an individual is amongst those fast responders or resolvers, if you will,
Right.
you'll know in that period of rehabilitation by gauging their participation, and they'll endorse whether or not they feel that. Because when you feel it, you know, and it's often endorsed if asked for. Patients often don't volunteer it because, again, they're fixated or on their more dramatic deficits and the challenges associated with them,
Right.
and quite often won't confide the sense of fatigue. But many will.
Okay.
If they don't, I'm just throwing it out there that always put it on your personal checklist to inquire about it, like some of the other invisible factors that you refer to in the wake of stroke, like
Sure.
post-stroke depression, etc. But if they have, if they're endorsing it in that early phase, I do reassure them that it is a natural part of the trajectory of recovery,
Right.
and that they should incorporate that into their rehabilitative journey. Once you have returned to your activities of daily living, there's a real motivation among some patients. And I counsel my patients in that setting to strike a balance between what is gratifying and productive versus what ends up becoming exhaustive and actually begins to adversely impact your rehabilitation.
You speak wise words. I know I've struggled with that myself. Has there been any research into what the causes of this fatigue?
I think the bigger questions sort of surround, as was mentioned, every case is different, and the studies are looking at sort of a heterogeneous group of patients. I think there are greater questions that surround late post-stroke fatigue, and it's felt to be a type of what has been called handicap fatigue in certain other neurologic disorders, where it is felt to be related to the increased energy demands on the body when people return to the real world, so to speak.
Right. Yes.
There's only so many scenarios that we're able to simulate with the sense of rigor
Sure.
in the rehabilitative environment before patients are really put back into the real world.
Right.
Absolutely. So, in respect to that idea, should a person try and push through, or not, or hold back, or it's interesting because Christine, she tried to push through,
Yeah.
and wow, the next day the impacts,
Yeah.
they were huge.
I agree.
And even now, it's very interesting to see that.
I agree. Again, it's a personalized treatment plan for each patient. In a patient who has a good trajectory of recovery in otherwise very isolated, discrete deficits, like a mild weakness, for example, on one side, problems with gait and dexterity and mobility, no mood-related issues, no cognitive or speech-related issues, very discrete deficits, and an associated component of fatigue. In that case, then, you can try to come up with a regime that balances the needs to want to stimulate what we call the neuronal plasticity
Right.
in that early phase of recovery where it's felt that more is more,
For sure.
with what is sustainable for the patient, to, as I said, to ensure that you don't end up so tiring yourself out that you are unable to productively participate for the next day or even couple of days.
Absolutely.
Right? And most experienced physiatrists and rehabilitative staff are very sensitive to this, and their inpatient and outpatient regimes are structured accordingly.
Right.
But it's just important to ensure that that dialogue between patient and practitioner exists.
Right.
Okay?
Right.
Now, post-stroke fatigue can also be part of many other aspects of stroke. It can be a symptom of post-stroke depression, for example. It can also be part and parcel of certain strokes that are associated with an increased latency of motor function, for example. It can be associated with certain strokes that affect our sleep-wake cycle.
Right.
It can be associated with certain strokes that affect our level of alertness.
Absolutely.
As well. So the treatment plan also needs to encompass those specific cases, and in certain cases where not just the logistics of the rehabilitative process are the sole consideration, but in those specific circumstances where specific drug therapy may be a complementary part of that process as well.
Which was a question that I actually have coming up here that I was going to ask you. You're just following this beautifully for me. Appreciate all your help. Obviously, a stroke survivor needs to be very involved in their team. Their caregivers and their therapists and these type of people. And, I was going to say, who are the best people to talk to about developing those strategies in terms of addressing this fatigue somehow? And you've beautifully answered that for me. But my secondary question to that was, is there medications that can aid in this sort of a situation?
Sure. We tend to be, I think the one that might be suggested as having both the greatest usage as well as utility is when post-stroke fatigue is associated with post-stroke depression.
Oh,
okay.
Okay.
And like post-stroke fatigue, post-stroke depression is felt not merely to be due to the emotional onslaught of a stroke, but has felt to have a biochemical basis as well.
Interesting.
Associated with the structural alteration of the brain in certain types of stroke as well.
Sure.
Okay? And consequently, it has been shown to respond to treatment, and also is often underappreciated as well, because those feelings the emotional component, shall we say, of depression, the mood-related symptoms of depression can often be felt to be simply part of, for want of a better word, the grieving process.
True.
Or what are presumed to be a natural emotional response in the wake of a stroke. But they are amenable to treatment, and many of the different families of antidepressants have been tested in this patient population and have shown effectiveness.
Right.
But importantly, effective treatment of post-stroke depression. Thank you for allowing me to straddle two soapboxes today.
Yeah, actually, that's fantastic. You are.
Is that its effective treatment does improve prognosis.
Very good.
Okay, as it does in other vascular syndromes, like even heart attack, for example. So,
right.
So that's one place, for example, where pharmacotherapy in the setting of post-stroke fatigue is beneficial.
Right.
Okay. In other circumstances, we have to be careful. There are certain stroke syndromes where that level of alertness can be due to the structural involvement of centers in the brain can be markedly impaired. And in that setting, there have been the investigation of the types of medications, for example, that have been used for attention deficit disorder, the amphetamine group of medications that have been used in the setting of various neurologic illnesses.
Interesting.
But the challenge is that they do tend to often be associated with potentially concerning increases in blood pressure as well, which is certainly something that we want to avoid moving forward in stroke risk reduction for these patients. So consideration of those medications is rare. The other medications that have been utilized, again, related to specific strokes that are associated with structural impairment and an increased latency of motor responses that can appear to be a type of fatigue, but really are a type of, increased motor latency, if you will. And there are various medications we have used or trialed in those patients, including some of the medications that have been otherwise used as treatment for our Parkinsonian patients. But I would say that for the most part, a shared strategy of paying special consideration to the logistics of the rehabilitative program, as well as screening for occult post-stroke depression and treating it avidly. These two approaches, I think, will serve the vast majority of our stroke patients who may be at risk for the functional challenges of post-stroke fatigue.
Well, that's fascinating. Absolutely.
That's very fascinating. Thank you so much for all your words of wisdom. So lastly, any last words of encouragement for stroke survivors?
I think that we always tend to say, indeed even since I was in medical school, which was before the TPA era,
Oh, wow.
right on the cusp of the TPA era, actually, is that improvement is always the rule. You can always count on some degree of improvement, and our and the challenges. I mean, the challenge is to allow yourself to celebrate the small victories that are part and parcel of the rehabilitative journey, and allow them to accumulate en route to the performance of very remarkable things that ensue.
Right.
Not unlike what you're doing here today.
Well, thank you.
Christine, if I may reiterate my thanks, not only for having me today, but indeed for just the, as I said, the impassioned sense of advocacy that you bring to your commitment to stroke education in the community. Now, you probably already know it all. I suspect you ferreted out every little bit of information about resources that are available. But I did contact my colleagues in regional stroke, and they have forwarded me a summary of community resources that are available.
Really?
It's about a 25-page document,
Right.
and so perhaps I could just forward it to you by email, and you can disseminate those resources if you haven't already.
I would be honored to do that, and thank you. Yeah, we're all on a journey. We're all students and teachers, so thank you for teaching us today.
Not at all. My pleasure.
So, to reiterate Dr. Saddiqui's wise words, allow yourself to celebrate all the small victories on your journey through recovery. Did you know that you can follow us on Twitter at 7Jars? We post daily with all the latest stroke research, innovation, and inspiration. follow us. Hey, Christine, have you ever noticed how sometimes if you just change your perspective a little bit, it sheds a whole new light on a situation?
Hey, that's true, Ken.
Well, one such thing that I try and do all the time, I don't call the bathroom the John anymore. I call it the gym. Do you know why?
Why,
Well,
Ken?
because that way it sounds better when I say I go to the gym first thing every morning.
Oh, Ken.
Now it's time for our segment on survivor stories. We'd love to hear from you. If you'd like to share your own stroke or survival story, or your experience as a caregiver, you can submit your story through our website at 7 Jars of Hot Pickled Peppers, or personal message us on Facebook. We look forward to reading your story. Today, Rachel shares her story as a young survivor of stroke, read by Christine.
I was 34 years old, raising my kids, working full-time, enjoying life to the fullest. I knew my life was stressful, trying to balance everything. I was busy, but I thought this was the way it was supposed to be. I began having some warning signs, but it never occurred to me I could be having a stroke. When I finally got help, I thought my life was over. I was paralyzed on my left side. I could only use one hand. When I tried to move my left side, my muscles were tight and stiff. It was painful. Rehab was slow and painful. I had to think and plan for every action I wanted to do. I had to relearn everything, even tying my shoes. I kept at it and saw some success. I'll never be what I used to be. And I've had to accept my new limits. But I've learned to spend my energy, my efforts, on what I love the most, instead of just being busy.
Thank you, Rachel, for your story and your wise words. And now it's time for Simply Put.
Hey, this is Christine. Here's the simple answers to questions you may have about stroke or your brain. These answers are from my personal experience with stroke and in no way replace the care and advice from your own healthcare provider. I'm no doctor, and sometimes I need simple answers to my question. So here's Simply Put.
So tell me, are there different types of strokes?
Well, there are many types of strokes, but simply put, here's 3 of the more common ones. The first and most common is an ischemic stroke, a blockage of blood leading to the brain. The second and less common is caused by blood vessels in the brain, bleeding directly into brain tissue. The third type is called a TIA and is sometimes called a warning stroke. It's the same as the blockage or ischemic stroke, but is temporary and usually lasts less than an hour. TIAs are sometimes called mini strokes.
And that's Simply Put. Fast. Recognizing the signs of stroke can be the first step to getting the best treatment for yourself or someone you love. Use the word fast to help you to remember. Face, is it drooping? Arms, can you raise both? Speech, is it slurred or jumbled? Time, call 911 right away. Don't drive yourself to the hospital. The ambulance can help you en route and will take you to where you need to be. Fast. Thanks for joining us today. Don't forget to like us on Facebook, or if you have any questions, comments, jokes, or ideas for future topics, contact us at our website, 7jarsofhotpickledpeppers.com. We'd love to hear from you. If you'd like to hear more about Christine's journey, please check out the website. Her book is available for purchase.
Thanks for joining us. Remember today's quote, and spend your energy wisely and on things that bring you joy. Goodbye and good health.